I'm Muskan Khandelwal and you are watching Indian Masterminds. Today, we have with us 2015 batch IAS officer Nupur Rashi Panna, the collector and DM of the Sakti district, which is the 33rd district of Chhattisgarh. This Panna has been taking numerous initiatives for malnourishment and healthcare. And today, we are going to talk to her about the initiatives she has been taking in the district. Hello and welcome to Indian Masterminds, ma'am.
Hello, Muskan. Thank you.
So you have been an administrator in various districts that are older in terms of their formation. So how different is it to administer a newly created district, and what are the challenges and benefits?
For a newly created district, for example, Sakti, first and foremost, the administration, setting up the administration and the HR is very, very important. And I feel that it is a tremendous learning opportunity for anyone, because it, it is something which you do it from start, like from scratch. So that is a very good learning initiative, learning which anyone can get. And plus, it is very beneficial for the people because, like in my district, people had to travel for like 3 hours to reach the headquarter. And as the district has been formed now, to if they have any issues, so the commute is lesser. And generally, these commute, if a common man does, either he'll do a bus or a vehicle, and if the person has to go multiple times, so time saving and the cost effective, both the ways. Establishing a district works, and administration plays a very huge important role, because we have to see that the poor people who have like really small requests of say a ration card or a pension or Aadhaar not being made, like they have very simple requests which can be catered much more easily. So that is the thing with establishing a new district.
Okay. So like under my other question is under staffing and inadequate infrastructure has been some of the biggest roadblocks in providing efficient healthcare to the citizens of India. So what measures have you implemented to tackle these challenges, and what is the situation now in your district?
Yes, as you rightly said, that healthcare is one of the most important aspects of anyone's life, whether the person is rich, poor, or belongs to a middle class. It is very, very important to provide the health facilities at cheaper rates and at at commutable areas. So, as we saw in COVID, COVID was like the eye opener for everyone. I feel how we had to ramp up our health facilities, how we had to provide our, not just the facilities, we had to provide services, we had to have trained HR, trained nurses, trained doctors. So that was a gap which was identified during COVID. And since I worked during COVID and saw, I think every administrative officer saw the gap which had occurred. So specifically in Sakti, we had around 114 health and wellness centers, and health and wellness centers basically are these centers. These are these sub health centers which are placed in a population of 5 to 7,000. So now the expectation of a health center to operate is basically the person should be able to, the person placed over there, the nursing staff over there, or the medical staff, or the medical officer who is placed there, whether it be a doctor, should be able to diagnose small, any type of, say, suppose a viral fever or cough, diarrhea, or eye flu, or this type of issues. This is like their primary work of looking at diseases which are non-communicable, and also to identify anything which is communicable. One of the most biggest aspects which we saw here in Sakti is we that even for a normal delivery, the person had to travel approximately 60 kilometers just to, get the delivery done, which is basically a very, what do you say? It is a very, it's like a basic right of a person for a normal delivery. And imagine when a person from the village does it, or a middle class person does it, or a higher class person does it, even in a facility which has very basic facilities. If that facility is a private facility, the normal delivery is going to cost you from 30,000 to 50,000, including the commute. And if it is a cesarean delivery, the cost escalates. So now our main point for Sam Shakti Abhiyan was, when we have the infrastructure, when we have the HR, why are we not able to do normal institutional deliveries at our health and wellness centers? So that was our major challenge, which we took up in the Sam Shakti project, and we established it from there on.
Okay, that's really great, ma'am. So you have commenced an initiative of Jan Chaupal. So, like, first of all, what is the purpose behind it?
So basically, as you know, every district has a different, geographic area. So Sakti district specifically, it is a plain area. It does not have a huge amount of, places which are non-reachable. It's not like that. Most of the roads are commutable. They have roads. We have a train line also. But even in a plain area, when we have a situation where people are not going there for their basic delivery, it is just a, what do you say? It is just a very problematic thing. So when we went to the health centers, when we visited the health center, we found out that every time, uh, even if my trained staff was there, a nurse who had the ability to deliver a child, the people did not have confidence. They said that, even in my book I have written, they have a line that says, "Ye bachchi to nahi hai." So basically, the nurse is very newly trained, and she would not be able to handle the complications. The biggest gap was trust. So to build that trust factor, when I said that, why don't people come to this particular center? It's a new center. Then they are like, "Ma'am, yahan aana nahi pasand karte." They would rather drive 50 kilometers and pay that much. And then I said, why? Then they said they do not have trust on us. I said, why don't we uh, go to the villagers? We go to the people who are the beneficiaries. We tell them that if you are pregnant, we are going to take care of you from whatever month you want us to, and a successful delivery will be done at your village itself. So that is the concept of Jan Chaupal. And as the team proceeded, they started doing Jan Chaupal. They started telling people as to what are the facilities present in the health centers. So that as soon as the Jan Chaupal started, people started getting convinced that, okay, we have to go to this particular place for delivery. We don't have to then take the hassle of traveling several hours and take the risk also during labor pain. So that was the role of Jan Chaupal.
So, like, what is the feedback?
So initially there was this health center known as Asondha. So it is right on the highway. So as I told you, I was very amazed to see that when we are not in a place which is a tough terrain place, even there we were not able to give deliveries. So in Asonda, we had old, skilled staff, RHO place, as well as a new staff, they were placed from past, now it's going to be 2 years. They were placed for the past 1 year. When we asked their record कि हाँ कितनी deliveries हुई है, then they're like, "Madam, आज तक एक भी नहीं हुई है." Then I was like, let us embed this thing that you have 8 to 9 villages under you. You go to the people and talk to the sarpanch, talk to the representatives of the village, and organize these Jan Chaupals. Jan Chaupal is supposed to be a small villa in which 10 to 15 people of the village go, and you talk about whatever health deliveries you are able to give. As soon as we started that, Asonda being a zero delivery point, it has done up to 9 deliveries till now. It is just after the intervention of Jan Chaupal. And the thing is, it was not a person dependency. Like, it was not a CMHO going or the collector going and talking to the people. No, it was driven by the health officials who were already staying there. So, because they see them day in and day out, so they develop the confidence. So, we had 19 such health and wellness centers, which were zero delivery points. And they are now the hubs where institutional delivery at the government facility at zero cost is happening.
That's really great, ma'am. So, like, I'll just want to ask a follow-up question. Like, how important is it for people to be aware of maternal health practices and early childcare?
Yes, it is very, very important. So, in the Sarv Shakti Abhiyan, so one of the major challenges which we faced was a lady who was pregnant for 9 months is able to be, she does not go for the first ANC. Like she's not able to identify her pregnancy itself because there is lack of awareness. So what we did was we focused on the target couple. Now, as per definition, the target couples are those people who are under the fertility age. However, if we see the fertility age, it is from 18 years to say 45 years. So that is a very huge rate for the medical staff to identify. So we said, okay, let us keep the fertility age aside. We will target those people who are getting newly married. So it is a very easy task that if it is in a village, so the sarpanch or the person who is an active member or the mitanin can definitely go and tell that okay, इस ward में 8 शादियां हुई है इस महीने. So they would give the names to the health officer, and the health officer will approach these women and these couples and say, if you want a child now, these are the methods. If you do not want a child now, these are the methods. So basically, identifying a pregnancy in the first month itself is very, very important, which we started doing in this particular project. Now, here came the point that there were several, this place is a migratory population. So there are several ladies who got pregnant and they go to field for working, and then they would come back. So this was one major issue. So once we started identifying these couples who were in that age and who had recently got married, so even the CHOs and the RHOs, the medical staff, they went up to the extent of making the people understand that, this is a very crucial time of your delivery. Once you go out and work as migrant labor, you will not get the facilities there. However, just spare these 9 months for the child and, pick up lesser work which is here, lesser tough work which is here. And once the child is delivered and you get the basic vaccination, you can leave then. So this was also an approach which was followed. So our aim was to identify the pregnancy as soon as it happens. So this was the key, which was a very good thing which happened in our project.
Okay, ma'am. So coming to the other healthcare initiatives that you have taken for is malnourishment. You have taken number of initiatives for malnourishment. So what prompted you to start these initiatives, and how have these initiatives changed the nutritional level of malnourished children?
Yes. So basically, for malnourishment, we under the umbrella of Sakti, we started the Spearheading program, in which we just said that a government officer, whether the person is a collector or the person is a police or any person who were placed in the district, they were asked to adopt just one child. That is a purely one-on-one child. The child which is severely malnourished or is in a category of malnourishment, but the reason for malnourishment is not purely just the food. The reason for malnourishment is basically the child either was born with some deficiency or has a separate, is physically challenged or has some issues, psychological issues. So in Snehit, we adopted, one person adopted just one child. And once that happened, a lot of cases were easier to achieve. They were able to reach the nourishment scale very easily, because when the officer went and said कि आप अपने बच्चे के ऊपर ऐसा ध्यान दीजिए, there were cases when officers also said that बच्चे को लाल चाय पसंद है. So once the officer started saying this, that means the officer went and they did not try to change the entire environment of the house. Even there were officers who, with their own initiative, they reached the child's house on the child's birthday. So these things really, helped us bridge the gap. And it was not only just the officers, admin officers engaged. The second way, we started engaging the Anganwadi Karyakarta, the Mitanin, the sector officers. So in this instance, it was just a one-on-one task. So basically, even the Mitanins felt this, I just have to do one kid. So in that, approximately, we had 2,200 children for whom we put the campaign and mapped one person. And we came up with the app saying that let us just report on the app as to how many number of visits are you doing, or a card a card basically said that, okay, I visited on week 1, the weight was this, the height was this, weight was this, height was this. So even if the officer changes, the father or the mother knows that these are the challenges the child is facing. And certain places also, we send also the child to higher center and also to our pediatrician saying that what is the issue? Is the child suffering from some kind of worms in his stomach? Is he not why just feeding the kid is not resolving the problem because the underlying issue was not identified earlier. So and just sending the kid to NRC with a specific dose, scientific dose, even did not solve problems. So we had this place where such kids were treated separately, and the kids which were more going towards the normal scale of nourishment, they were treated separately.
Okay, so if I'm not wrong, you have also launched the Snehit app. So if you could please
Yes.
share something about it.
The Snehit app is a very simple app. It is similar to our portion tracker. And in the portion tracker, it is the Anganwadi Karyakarta who does all the logging in and filling each. But the Anganwadi Karyakarta has to look at like 20 children, not 30 children. But in Snehit app, it is just one child per officer. The officer is given a login, and the officer is able to just fill in the weight of the child whenever he visits with it. And plus, there is a card in which if there is a specific requirement of the child or the child is a special child, so we need to that gets allowed planned. So there have been cases in which even certain children were identified. They were in such crucial situation that due to malnourishment and other factors, they could not survive. So even with one of the health members, this also happened. So since they had developed a connect, so it was a very sad thing that even now we have kids dying from malnourishment. So even those things got flagged that it is alarming and why we need to take a one-on-one care.
Okay, so as we know that AI is all rage nowadays, so how are you incorporating AI and machine learning technologies in your initiatives, and how do you think this sort of tech will impact the situation on ground?
Yes. So basically, we now since WhatsApp is it's a very good mode of communication, which is very used. As I told you, that once our centers were up, so basically we in Shakti we did with our health centers we did two things. We did training as well as leveraging and making our health centers good. We gave them good birth tables. We gave them good equipment. We asked them to go for Jan Chaupal. We made areas where medical officers could stay well, and several aspects we developed both on the HRS and infrastructure side. Now, in WhatsApp, we still have a group in which basically as soon as the baby is born, so there's a particular format in which the baby is photographed along with the weight of the photograph, the RHO or the CHO who has done the delivery, time of the delivery is reported. So, and in case, say suppose either if the baby is very overweight or has a very low birth weight, it is reported then and there. So, in my if I would say, how would you implement AI in that? I think there should be something which maybe a chat reader or a chatbot in which all these messages, all this data which comes in then and there is reported and read by the techniques of artificial intelligence. And if there is a situation where the mother is still bleeding after the delivery or has gone into some kind of medical complication or the child is not responding or anything, it should be picked up then and there. So basically what will happen is our maternal death and child death, this will be curtailed to a very large level because at that point itself, as soon as the photograph and the weight is assigned and the CO2 thing, all okay or all not okay, we could have some help running to them or a telecommunication running to the medical staff there, guiding them as to what is the next step to be done. So, like we had a case in which a baby was born, which it did not have a sternum. Basically, his rib cage did not have a sternum. And we got the photograph of the baby along with the video of the baby breathing then and there. So that was the very moment we rushed the baby to the higher up medical authorities. saying this is the case. And after that, even from after test, we went to the higher child specialist care, where they said that slowly the serum will develop and the baby will be normal. So it was, if we report the incident then and there and we use AI, we will be able to, avoid all these losses of life which we are having as of now. So that is where I think AI should play a role in this.
Okay, ma'am. So these initiatives have kind of proved to be vital in making the healthcare system in Sakti more accessible to people. So, what are the chances that other districts might adopt these measures, and how effectively do you think that other districts can incorporate?
Yes. So basically, we have had several other districts who have taken up initiatives for malnourishment and the adoption program, that is the spearheading program. And other districts, the equations which are used in this particular program, this is something which is easily scalable, and because it just involves focusing on each and every health centers. We just need to motivate our health staff. We just need to motivate our health staff that they can deliver much more to the society and also to the people. So basically, in this particular program, even if the scale of administration changes or renews, a person at the village level, he will always say कि delivery के लिए मुझे वहाँ नहीं ले जाना है. I will go to whatever is closest, because the person knows कि now deliveries are at his doorstep. So this, and if it does not happen later, the person who is at the village level or the person who is at the city level, they will question as to why has the program stopped? Why is it not running? So that will create a social pressure as to we have to provide these facilities at government institutes, which is very, very essential, because healthcare is something in which the richest of the richest can poor, and the poor of the poorest can get into the trap of finances and depression. So I think healthcare in this Sun Shakti project, it is a very easy, implementable, scalable project in which we are focusing at the people, and we just revamped whatever was there already. So I think it is very easily adoptable and scalable. And I would wish that it is scalable at all other districts, so that healthcare services for each one is delivered in the right way.
Right. So before concluding this discussion, I would like to ask you, what are your future plans for Sakti district?
Yes, for future plans for Sakti district, basically now for health facilities, we are extending. Initially, there were no cesareans happening here. We started cesarean and operations. We have reached a record of 254 cesareans have already happened. We have increased the number of beds here, which are reaching up to 40 beds. Earlier, we just had 20 beds. And we are increasing our healthcare staff, so that until and unless we provide the staff with the requisite amount of training, we will not be able to perform how much ever equipment we give. So that is one major thing which I would like to focus in Sakti. And moving forward, I think it should have all the health facilities. And since it is a district which is on the national highway, I think it is a very good hub which can be developed further. And even it is the location wise, it can take up trauma cases also. So I think health wise is one of the major special areas where I'd like to focus.
That's really great, ma'am. So thank you so much, ma'am, for giving your time. We hope that you take such initiatives for the people of Sakti district.
Thank you, Muskan. Thank you.